hope you can hear me. Let me know if you can hear me. Welcome to this live. Let me know where you are watching from. We talk about what your doctor will want you to know. I'll be sharing some of those things with you. Welcome to this live. Thank you for tuning in. Just let me know where you are watching from. Yeah. Who is first to join in? Kindly drop a comment in the chat. Let me know where you are joining from. Welcome to this live. It's a pleasant evening from this side. Let me know where you are watching from and what time it is in your location. Who is here? I hope I'm audible. Kindly confirm that you can hear me. Hello, welcome. It's nice to have you here. Let me know where you are watching from. Thank you for tuning in. Just a time to share together some interesting moments. Okay, just let me know um, where you are watching from. I'd like to meet you. Thank you. Thank you. Please let me know if you can hear me. I hope I'm audible. Who is here? Okay, I know it takes some time to type, and hopefully we get we get to see you soon. Welcome once again. Thank you for tuning in. Welcome to this live. I promise this to be interesting. Remember to like this live, click on the like button or double tap on your screen so that the system can help more people to connect. So sometimes I may come up like this to just share briefly. Okay, we just have some moments of interaction. Um, sometimes people have questions, and I put up a poll some time ago. I mean, some days ago about the segment that will be coming up soon on this channel. We'll be having a question and answer segment. We have a specific day, and I am looking at possibility of a Sunday, which is a day in the weekend to start with. Okay, of course, we have more opportunities to interact, but we may dedicate that for a start for questions and answers for people from different parts of the world. You can ask your question anytime. All right. So, but interestingly, there are many things that your doctor, I don't know where your doctor is, but somehow, whether you are going for a checkup, normal medical checkup, or you have a complaint, you have a symptom that you want to get your doctor to know about and to help you treat appropriately to overcome that, then there are some things that you need to know that your doctor uh, will want you to know. A doctor wants you to know these things. Okay, so let me know if you have any question in the chat, so that we can interact better. Let me know where you are watching from, and if you have a doctor, where's your doctor? Where's your doctor? All right. So one of the things that is very important is to, okay, thank you for the likes. We have 2 likes already. Thank you for the likes. I believe that you can hear me clearly, and then the video is okay. Just let me know in the chat if you can. Thank you. I really appreciate the feedback. Thank you for the like, thumbs up, more of it. Okay. So we are a wonderful community. If you are joining in or coming across this channel for the first time, the health, wellness, and lifestyle channel. Sometimes I share my YouTube experiences. Okay, but most of the time, we come to I share about health matters, sexual health, reproductive, family health, mental health, and of course, management of chronic medical disorders. Talk a lot about hypertension. We talk about diabetes, other chronic conditions. All right, arthritis. So, but for this particular live, it's just going to be very interactive. I'm looking forward to hearing from you, seeing your messages. Okay. So, but just as I'm communicating with you and I'm asking for a feedback, one of the things that you need to know as an individual is that if you have any need, you need to interact with a doctor, your medical doctor, your physician, um, whether it's medical or surgical, whatever it is, or even any medical professional. One thing that is very important is the need to understand that communication is key. And when I say communication, communication is two-way. Your doctor is ready to ask you questions, and then you are ready to respond appropriately. Asking you questions basically, from the general approach. From a general approach, I want to put up a poll. Where are you watching? Are you joining? Okay, kindly respond to the question. There's a question there. Thank you. Okay, so we are starting this. Where are you watching from? So everyone joining in, just let me know where you are watching from. Okay, I really appreciate your feedback. All right, and remember to double tap on your screen to like the live, and hopefully that will help more people to be notified of this live. All right, so let me know how your day has been and what time actually it is in your location. I know people are joining in from different parts of the world. So, live from Nigeria. So, where are you watching from? Thank you. Thank you for your responses. So, I'm glad to have you here. So, I was talking about one of the things that you need to understand as an individual. At one time or the other, you will need to definitely interact with a healthcare provider, uh, medical doctor, nurse, other health workers. But I'm talking about what your doctor will want you to use, whether it's a first time you are seeing a doctor, or it's a your family doctor or your physician, a surgeon, one thing that you must have registered on your mind, which you should be conscious of, no matter your personality, is the importance of communication. Okay, so communication is essential. All right. One of the reasons why you are approaching your doctor, why you are going to the hospital or communicating, making a call, getting into a virtual consultation or a physical consultation with a doctor is because you want, it's either you need information or you need some form of assistance, treatment for a condition, a symptom that you don't know what exactly it means. In fact, maybe you have actually used some over the counter medications, and yet you you are yet to get some relief from that symptom. Then you have a purpose. You have good reasons to visit your doctor, to visit the hospital or a clinic. So, one very important aspect of interaction for me now as a medical doctor, I really appreciate it when my patient is able to communicate, able to express themselves, and of course that begins with greetings, exchanging greetings, and that is very important. So you need to feel comfortable. Your doctor wants you to feel comfortable. Even though we have different personalities when it comes to individuals, whether doctor or the patient, but one thing that must happen within the interaction of the doctor patient relationship is communication. And that applies to any other type of kind of relationship. I'm sure you know that communication is essential. Okay, so I don't really know what is in your heart when you come to my clinic or when you get to the consulting room. I have to see you, or whether it's a virtual consultation, I need to hear from you. All right, so you must have that confidence. You must be confident as an individual, no matter your personality, to communicate with your doctor. Okay, some people are naturally shy, they don't talk much. Okay, but the fact is that you cannot be quiet and expect your doctor to automatically know why you are in the consulting room. All right. Of course, there are some places where appointments are booked ahead. You share the symptoms that you have. If you don't do that, whether it's by what do you call it now? Technology, you're trying to communicate um, via email, or you're having a Zoom, you need to send a message, SMS, whatever form of communication, there still has to be expression. So, what I am actually calling your attention to is the fact that you need to be able to express yourself as an individual, even when you are with your doctor. All right. So, uh, I don't know what your experience has been before now, okay, but that must be something that you become conscious of. Some information may be missing if you decide to go by your maybe quiet personality, you're an introvert. This is not a time to be an introvert, okay? Of course, your doctor has his own part, his own role to play. Okay, so your doctor is positioned to actually ask you questions, and your doctor expects you to give appropriate responses. And then, even if there's an area that your doctor is yet to request, ask a question, or talk about, you as an individual, you have a right, you are positioned. That's why you are there in the consulting room to actually communicate with your doctor. All right. Wow. Good to have you here. Now, no, maybe I didn't see what you posted, but I can see that you say you are number one. Noemi dear says number one. Thank you for tuning in. Thank you for joining in. Well, I really like to know where you're watching from. All right, thank you. Our mama is here. Diabetes Mindful Talks, representing so well, doing so much with patients or people all over the world on diabetes. I really celebrate you. I appreciate all that you do. Thank you for the it takes a lot when it comes to it's like sometimes it's actually the extra. Many patients complain about not having enough time to interact with their doctor or even nurses. Okay, everybody is quite busy, especially in the hospital setting. So sometimes when people are able to have access, like you're giving them access, I'm talking about diabetes mindful talks, a lot of work there. They're giving access, information. I was on the live the other time, where we are talking about urological aspects when it comes to diabetes and sexual aspects. So many people joined in, and then a lot of people they ask questions, and I really appreciate what you've been doing and what you've done today, and with the doctor that you invited. Okay, so I celebrate you, Mama, and keep up the good work. I want to add you as moderator, and I look forward to showing up. I mean, we'll be going live together sometime soon, working on that. So you can check out our channel and follow appropriately. Diabetes Mindful Talks. She has a lot of content on our channel. She's passionate about care for patients with diabetes, and we look forward to um, discussions around this sometime soon. Okay, so she's watching live from Belgium. Yes, good to have you with us. Good to have you with us. How was the session, Ma? I hope it was. I mean, I was there, so I know a lot of people joined in, and then people were asking questions, and the doctor and you yourself, you were giving information. So thank you for joining all the way from Belgium. And what time is it in Belgium? Please let's know what time it is in Belgium. Pardon me, I'll just have a brief on the video. What time is it in Belgium? By the way, she's a nurse, diabetes mindful talks. She is a nurse. That's the host on the channel. So I had to sip some water. Thank you. Okay, DMT said, "Hey everyone, yes, thank you. Watching from Belgium. Yes, my pleasure, sir. Thank you. Yes, good to have you with us. Yes, can't wait to have a collaboration with you. Yes, looking forward to that. Thank you, man. Thank you. You're welcome for the blue jacket. So we are talking about what the doctor wants you to know. I'm sure you will be able to add to this. Of course, when your doctor wants you to know something, definitely we are a team, nurses, pharmacists, physiotherapists, nutritionists, dietitians. We all work together as a team. Okay, so but one thing is common to all of us. Any member. Hope you can still hear me. Hope I'm audible. I hope I don't want the audio to fail in any way. Please let me know in the chat if you can hear me. So we do one thing in common, that is to communicate. Apart from the specifics, whether I'm a family physician, for example, so I interact with individuals, families, in the context of their families, communities, and then offering continuing care, and you know I am involved in education as I'm doing right now. Okay, but as a nurse specialized in care for diabetic patients, one very important thing, I'm sure Diabetes Mindful Talks will, I'm sure you will agree with me that communication, wow, communication is a key aspect of your work and your commitment to uh, the patients, I'll say clients or individuals that are part of your community all over the world. Okay, so if I'm not communicating as I am presently, sometimes it's a challenge for me. I am looking forward to a time where YouTube will go beyond going live together to, someone can just click. Okay, I think people also do it now. I can post a link of live going live together on the chat or in the community post, and then someone can click on it and then join the live. Okay, but there are some other platforms like WhatsApp. You can add someone to the live. Okay, so I'm looking forward to such a time. So maybe automatically I could just add someone. Now we have something massive happening here. DMT has done something here. I'm so grateful. Thank you for this super. It's a super. Thank you so much. Wow, wow. Thank you. This is this amazing. I must say thank you so much for your support. Wow, 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 wow. Thank you so much. Thank you so much, Mama. Everyone, please help appreciate our nurse, Diabetes Mindful Talk. She just dropped some super in the chat. Thank you so much. I appreciate this. Thank you. So everyone, you're welcome. You can drop the super chats. I mean, people have been doing that. Sometimes I say, oh, some people really know that their doctor also um, should enjoy that kind of support. Yes, I appreciate it. Thank you so much. I really appreciate this. Thank you, DMT. Jen. Welcome, Jennifer. Thank you for tuning in. Thank you. Jennifer says, well done, Doc. Thank you, Jennifer. Thank you so much. Thank you for tuning in. How has been your day? And thank you for your support. I mean, you've been wonderful watching videos, commenting, liking. There's a way the analytics and then the notifications come that we get to see who has been there and who is showing up. Thank you so much. And then DMT, Diabetes Mindful Talks, does not just support with super chats. I mean, she's been watching and I've been seeing your comments, Ma. Thank you so much. Thank you. Thank you for your encouragement, for your support. Okay, yes, DMT says communication is indeed a key. Yes, a key aspect of our health. In fact, when it comes to relationships generally, communication is key. It's key. And Jennifer says she's joining live from this same city, Lagos. Thank you, Jen, for joining in. Thank you for watching. Thank you for engaging. DMT says, Amen, Amen. More blessings, more grace to you. Wow, DMT says, yes, so doctor, All right, so we're still talking about what the doctor wants you to know. You know, the I'm sure the nurse here will be able to tell us. And if you are a health professional, you know the importance of communication. You know, there are times that some patients actually miss their clinic appointments, and not just because I'm talking about maybe in a local setting where you have to probably fill in on a card the appointment date. Okay, maybe the doctor writes number of days or weeks or months for the appointment, you know, and then the patient is expected to take it to the record office and then get booked. Imagine if the patient didn't hear the doctor, I mean, clearly about the need to present at the medical records to have a booking for the next appointment. You know, such a patient may just decide to go to the next place rather than following the process. Okay, so with that, especially with the older ones, the elderly, they may miss that kind of appointment, and by the time they come back, you know, so many things could have happened in between. So it is very important. Communication is essential. Whether we're talking about communication, is a two-way thing. It's not just about uh, the doctor expecting the patient or client to communicate. I mean, talk to them, ask questions, respond to the questions that have been asked. Okay. So what your doctor normally would do is to okay, let me see this. Okay, so I'm pinning this because I want people to check out DMT, Diabetes Mindful Talks. You can check out our channel, follow, you can check it after this session. You can subscribe to the channel. If you want, you can check it out right now and see how she's doing a lot. And I wanted to know that very soon we'll be having the collaboration and it's going to be a big one. So watch out. And that's actually what we have had in plan for this year, and working to have patients coming to share their experiences, other healthcare providers, doctors, nurses, other specialties, I mean, coming in to share with us. You know, wouldn't you like to have a physiotherapist coming on this channel? I'm sure you find it interesting. A nutritionist, dietitian, you know. So these are areas that we look at. Thank you, DNT. She says, yes, so oh, doctor, you deserve it. Okay, thank you. I really appreciate. So whether from the side of the patient, expectation is communication. You need to talk, and then from the side of the doctor, your patient, if you're a doctor or a healthcare provider, health professional, you need to understand that your patient wants you to talk to them. Okay. Sometimes, you know, on this side, we have to go beyond ourselves, go beyond this my personality. I hope I'm audible. Now this my personality. I don't want to be seen as talking too much. No, no. As a healthcare provider or a health professional, communication is a key aspect of what we do, and we should be doing that appropriately and do it well. Interestingly, some patients at the end of a consultation will let you know whether they've enjoyed consulting with you or not. Okay. Some people even leave your consulting room as a doctor or any other health profession. They leave with a sense of healing already, you know, even before taking or not even having a need to take medications. Okay, so we must position ourselves, and as doctors, other health professionals, and then as patients, we must all position ourselves to get the best. If there's no proper communication, if the communication is not detailed, if it is not, when I say detailed, yes, it covers different aspects, and if it doesn't engage well enough. If it's just stereotype or question and answer, sometimes for me, I am a bit more sensitive in the sense of whether spiritually as a Christian, I'm sensitive to the different patients that I come across or clients, because individuals we all differ in different things, in many things, whether spiritually, spiritually speaking, I've had opportunities to meet with different people with different beliefs, with different spiritual beliefs, different practices. As a family physician, as a doctor, primary care, I have access to different people. So, but I do not allow that to affect my communication. But I'm sensitive, first of all, to know, okay, maybe God has something to let me know about this person. I don't necessarily have to say anything relating to what I perceive, but as a medical doctor, I can talk in a way to hit on the points that God has put in my heart relating to the person. And that may actually be the reason for the visit. That some people visit because they are actually not because they have a high BP. Of course, people have high blood pressure because there's a family history, dietary, poor diet and lifestyle. But somebody can also have because of stress induced, anxiety. Okay, so if as a medical doctor, I just go ahead to look at the blood pressure and say, okay, just take your blood pressure medication, which is very important. But the fact that for such an individual, for that individual, there is a trigger, there's something that's causing it. And if that is not identified and dealt with, that condition may persist. Okay, so that's where uh, holistic care comes in. All right. So, but that holistic care cannot be given if there is no communication, and the communication goes in different areas. So, you shouldn't feel embarrassed or ashamed, especially for those. Some people actually come to the hospital and say, "Oh, this is my first time visiting the hospital. This is my first time visiting the hospital. Please let me know where you are joining from. Let me know where you are joining from. If you're just tuning in, if you're just coming across this channel, you may like to introduce yourself. Okay, I'm going to share this in the talking about. I'm putting so much emphasis on the communication because it's a key aspect, and if it is that foundation is faulty, is wrong, then we are sure that nothing productive is going to come out of that consultation or interaction. Okay, so I want to say if you are an individual that you need the service of a doctor at any time, your doctor wants you to speak out. You need to speak out, you need to express yourself, you need to go beyond what your doctor is asking to saying the things that your doctor may not ask. In fact, some people have had opportunities to interact with patients that give one or two information that, oh, thank you for that information. Okay. And that sometimes just helps to deal with the matter in a way that we might not possibly have dealt with. So it gives that holistic approach to care. So if you are going to get, whether it's a 10 minutes, 20 minutes, or 30 minutes of interaction with your doctor, you're going to get the maximum benefits from that interaction. Then you should ensure that you are going in with a consciousness of I'm here to communicate. You are not there for an interview in the sense that, oh, you need, maybe they're going to give you a job, or you're applying for a school, to a school for a program, but you're going there to interact with a person. Your doctor is a person. I respect all the doctors in the house, all the nurses, health providers, health professionals. I respect all the professionals on this live. But I'm telling you that no matter what level you are in your profession, you are still human. You're an individual, and people should be able to relate with you. So I make it easy for my patients. No matter, sometimes I'm even tired. I feel tired. I feel I need to rest myself. I don't feel like talking sometimes, but because the passion is there, because the love is there. Okay, so I just have to go that extra to ensure that I give my best to that individual that's coming into the consulting room. Okay, so when people come and say, "Oh, I like the way you spoke with me. I'm even feeling better now." No, it's just the grace of God, and then a willingness, a commitment to giving you the best that you deserve. Okay, so you should look at it that way. Some people say, "Oh, that doctor was just frowning. I couldn't even see anything. I could not even ask any question. I don't even know what the diagnosis is." People come out like that. Okay, DMT, do you know sometimes it happens like that? Okay, that's our nurse in the house, Diabetes Mindful Talks. You can check out our channel, okay, and follow her. Now, if you are still here, you will know that there are some patients that come out. In fact, some people go home, not just that they are talking to the nurse, even though the nurse definitely has access, based on the teamwork that, oh, this is likely, this is the diagnosis, especially for those who are on admission, to know what patient is being managed for. Okay. But do you know that there are some people on outpatient basis, for example, and even in this environment, there are some people that they are even being managed on admission, and they say their doctor did not tell them. When they say the doctor did not tell me the diagnosis, I mean, that really touches my heart. One, see that they didn't actually hear when the doctor said it, or the doctor did not say in details for them to understand, or in a way for the patient to understand. Okay. For example, there are different conditions when it comes to diabetes. There are different other conditions, complications around diabetes. Okay. There's something called peripheral neuropathy. There's cataract. So if a patient has some symptoms in the eyes, and then they have a condition of blood sugar, there has to be a way that the doctor will help the patient to understand that what they are having currently, the symptom or a complication, is a complication from the condition or a diagnosis that they are already being managed for. Okay, so you as a patient, you have a right to ask your doctor what the diagnosis is. So you don't need to feel inferior. You don't need to feel condemned. You don't need to feel that you're asking too much. In fact, you've paid for it. You paid for it, whether out of pocket or you're under insurance, whatever system you are using. You somebody has paid for that service, and so you deserve the best. So you should be able to ask your doctor questions, whether in terms of diagnosis, whether in terms of treatment, and all. So that's one thing your doctor wants you to know. Communication is essential. Okay. So I'll just mention some things relating to that communication. What you need to know is that you need to talk about the symptom or the symptoms that you have as an individual. If you are having some symptoms, or even if you just came for a medical checkup, you should let your doctor know what you came for. Okay. And your doctor will definitely explore, ask you the complaint, apart from your biodata, the complaint and how the complaint had progressed, the complaint, how the cause had been. That's COURSE. And then any possibilities of complications, your doctor. So don't think that your doctor is asking too much or too many questions. Doctors are expected to talk a lot. If they told me I will be talking this much today, say no, it's not possible. Okay, but God brought me into this line, and I have grown and I'm growing in it, and I believe that I have a voice. My voice needs to be heard on these things. Okay, so if you as a patient have seen it that, oh, your doctor is talking too much, your doctor, no, you may miss out on receiving the best that you deserve in terms of the care. Please let me know if you can hear me. you can still hear me. Let me know if you can hear me. If you're just joining in, welcome. Let me know where you are joining in from. Remember to double tap on your screen to like the live. We are live. Let me know if you have been here, who is still here, or who is just joining in. Right. Okay. So apart from the cause, the complication, have you had any treatment so far for the for the um, condition, for the symptom that you have complained about? Okay. Some people would have actually taken some form of treatment that could have affected the symptom in a way. For example, for people with skin infections, skin lesions, all kinds of skin conditions, sometimes those things look alike, but sometimes they are actually marked by treatment. So if you don't talk to that extent of letting your doctor know what treatment you have received so far, then of course, your doctor should get your diagnosis and know how to go about that. Next has to do with the past medical history. It's very important. You know, some people talk about, we still get to that. I'll quickly run through it. Past medical history, for example, includes that if you are currently being diagnosed of diabetes, you should also let your doctor know that you've probably been diagnosed of dyslipidemia or high levels of cholesterol, and then you are on medications for that. If you don't do that, there's a way your doctor may need to uh, draw a plan for your management that will involve considering other conditions or medications that you are taking. So if you don't share that, if you don't talk about it, whether in terms of what you have had before, past medical history, or what you are currently also being treated for, especially if you are appearing in a center for the first time or seeing a new doctor for the first time. Most of the time, if you are using the same center, of course, there is your record. There's usually a record office for the electronic medical records. It's on the system, so your doctor can access previous information, whether you are using a file, physical file, hard copies. Your doctor can also check on these things. But don't feel overwhelmed or burdened that your doctor is asking questions relating to what you think another doctor had asked before. Okay, it's always important. There may be one or two information that the previous encounters, the doctors you might have met actually missed out. So you should be free. You should relax and enjoy the time. Some people are actually looking for opportunities to spend time to express themselves with the doctor. So if you have that opportunity, I think you should maximize it. Maximize it. Don't waste it. Especially if you're on this side, in Africa, in Nigeria, for example, talking about the Jackpot syndrome and all, there are more patients than doctors. Okay, I was going to say there are more doctors than patients. That's not true. Okay, ratio of one doctor to the patient. I don't know what it is now. I need to check. Okay, but the burden is there. So people want to spend just few minutes with patients and then move to the next patient and move to the next patient and move to the next patient. Okay, but if you have opportunity to communicate, to relate with the doctor, please maximize the time. Okay, if you have a past surgical history, you should mention it. If you have other medications that you are using before coming, you should be able to let your doctor know those medications. You should also be able to uh, let your doctor know if you have any allergies. Some people have taken certain medications outside of that setting, same hospital that they are presently, and they have reacted in such a way that it even required being admitted and treated in a hospital, receiving some injections. Okay, so if you have had such an experience, It's very important for you to get your doctor aware. Okay. In fact, some nurses handle that too. They take history information, especially if you are doing antenatal to are imputed on your records, in your records, on your on the system, so that if there was a medication that triggered a reaction before, such a medication is avoided for you. Some people have actually passed because, but another time they were exposed to same medication and they possibly passed on. So there are situations like that, and we need to avoid these things, even if it's not talking about mortality, but the morbidity, the extent of reaction with may get worse with a second exposure sometimes. Thank you for the likes. We have 5 likes now. Thank you so much. Thank you. Let me know where you are joining from. Thank you. And if you are just joining in, remember to double tap on your screen. Remember to double tap on your screen. Okay, so we just share some more and then we'll catch up again. Now, another thing, okay, I was still talking about the important aspects of the communication. Apart from talking about your drug history, a doctor will take consent for an examination most of the time, a general examination and any part, specific areas that need to be checked. All right. And then the relevant investigations. Okay. I like patients who ask questions. Okay, doctor, what test am I doing? What am I doing? Okay. I take time to explain this to some of my patients. Most of the patients, of course, they ask and try to summarize and so as to maximize the time. Before they ask, most of the time it's preferable, and I do that to let them know, okay, you are going to do this, you are going to do that, so that we can confirm this diagnosis or condition. Of course, there are some conditions that are basically clinical. That is, you don't necessarily require running tests to confirm to make a diagnosis. Okay, so you need to note that. And now let's go to medications. Many times, apart from investigations, people need to take certain medications. Okay, I need to let you know that it's important to let your doctor know. A doctor wants to that you should let him or her know that you should talk about the medications that you have been on prior to presentation, so that that may also be noted if there are investigations that are being requested, that the medications that you have taken could alter the um, results. Okay, for example, if you are going to do urinalysis, analysis of your urine test, and you have taken some medications, and you're talking about doing microscopy, culture, and sensitivity, there may be some changes in the report because of the medications. If it has actually treated the condition, I mean, treated if it's bacterial, if it has handled the bacteria. Okay, so if the bacteria has been cleared, the infection has been cleared, then it will not show in the reports that there is any infection. So that does not mean that you didn't have an infection. So it is important to communicate on the type of medications that you have been on prior, and your doctor can then decide whether uh, options that are available, and whether there are other steps that need to be taken. All right. So, what your doctor wants you to know relating to medications is that you should take your medications as prescribed. Okay. People have challenges in this area, so and I need to talk about it. Now, most of the time, the language in writing, there are actually medical terms that are used, signs and all that are used on the prescription. So your pharmacist should understand. Normally, your pharmacist should understand. But if you go to the side beside the house, some places are not pharmacists actually. You know, you may not get someone to actually give you correct interpretation of what a doctor has written as a prescription. So some people find out that they don't use medications as prescribed because they didn't get a pharmacist, a correct pharmacist that knows their onions will definitely let you know how your medication should be taken. Okay, so this can affect treatment outcomes. For those that are aware, if you are in Nigeria, I'm sure you just have to note and take the second dose after the 8 hours after the first dose of taking the antimalarial, the first dose. Now, I'm saying it again. For that particular combination of antimalarial, the second dose is to be taken 8 hours after the first dose, and it should be taken with meal or after meal, fatty meal. So if you don't get this kind of communication from your pharmacy, then or explanation on how to take your medications, then there may be some challenge with recovery. All right. Didi is here. Didi Ratty. Hello. Good to have you here. Didi says, good evening, Doc. Good evening, Didi. Good to have you here. The woman with the full hair. Yeah. Interesting. Good to have you here. I was going through your channel earlier today or yesterday. I checked on that shot. You have one shot that went viral, and I saw that you're making your hair there. Wow, good. Just do what you know how to do best. And interestingly, you are in the media also. You do a lot best. So well done, Didi. Good to have you join us. Thank you for joining in all the way from Nigeria. Okay, I'll say Abuja, right? ABJ. And then watching um, my stream from Lagos. Thank you for watching. Thank you for tuning in. It's good to have you here. Thank you. Thank you. Thank you. Thank you. Yeah, one of those I will call most present on YouTube, right? You are one of those in that category, most present on YouTube. Live streaming almost every day. All right, so um, keep it up. Sometimes I see the way people interact with some sense of connection, um, building relationships, and entertainment. There's always a need to relax. Every time people take things seriously, we just getting so serious. It's good to be serious, but it's also good to find time to relax. And I can't forget the fact that you smile, you laugh. I mean, you make people, you enjoy yourself, and then you enjoy time with others. And I'm sure that's one of the things that make people keep coming around to your live and watching your videos. Okay, so I want to say keep up the good work, Didi. Then we talk more. The time I was trying to greet you and the prince, and we talk more on that. So I will give you this moderator. Yes, and the moderator. Didi is a content creator. She's OAP, right? So we celebrate you, Didi. Celebrate you. Thank you for all you do. Yeah, Didi says, thank you so much, Doc. I feel very honored. Yes, you are honorable, right? You are honorable. Honorable Didi. Yeah, you are well respected. We celebrate you. Okay, thank you for the sixth like. Thank you so much. Thank you, thank you, thank you for your support. And I must say that I've been seeing your messages, your comments, the likes on my videos, on the shorts, on the posts. Thank you for the comments. I really appreciate your feedback and support. Uh, it goes a long way. Okay. So thank you so much. Welcome also. I say thank you so much, Doc. I feel honored. Yes. You deserve it. All right. Honorable Didi. Okay, so we've been talking about what your doctor wants you to know. All right. Where is your doctor, Didi? Do you have a personal, maybe a family doctor, or some people use private settings, some people use government hospitals. At one time or the other. Okay. So where do you use? Where's your doctor? Okay, but we've been sharing on what your doctor wants you to know. And one emphasis that I've made is on communication. The doctor wants you to know that you should be free to express yourself when you come into the consulting room. Even if your doctor is frowning, please find a way, if you can find a way to help your doctor to smile, I don't know. But the important thing is to get what you want to be done. Okay. But you have to also care for your doctor, show like somebody showed support today. Okay. Diabetes mindful talks. Didi, before you came in, she dropped some super chat. Okay, so sometimes a patient goes into the consulting room and is looking at, oh, this doctor, you don't actually know what your doctor might be going through. Okay, but the point is that your doctor is expected, no matter how they feel, to still do what they need to do, what needs to be done when it comes to communicating and offering you the service or the services that you need. Okay, so it's important on the side of the patient to be expressive. Important on the side of the doctor to be expressive. So if you have any information that your doctor did not even attempt to ask about, you need to be able to give it, because that may help to undo a particular side of your management or the overall plan. Okay, so it's very important. Then I was talking about, you came in, I think you joined in at the time we're talking about medications. You know, there are over the counter medications, very good. People can use, you can use them. You can go, let me adjust myself. You can go and use, get medications if you need, especially in this cold season. We'll be talking more about this on this side, rainy, cold. But there are people that need medications apart from doing the natural things to keep to stay healthy. Okay, but if you are going to with your doctor after the consultation, you also need to look at the prescription. Many times people have access, some people have access to prescription sheets, is given to them. Others, they have to just go to the pharmacy, and then because there is the EMR, electronic medical record, where there's a system where the doctor sends requests for investigations, and I have that in my center. We send requests for to the pharmacy so that The individual just needs to step to those places and get the appropriate services. Now, okay, Didi says, yes, sir, we have a family doctor here in Abuja. Okay, very fantastic personnel. Wow. And we also registered in one private hospital here in Abuja. Great. Great. Good to know. Yeah, so I like that testimony of your doctor's personality. Okay, very good. Okay, so people like to keep with such people. Uh, I get people wanting. I want to see you, doctor. You're the one I want to see. Those are individuals who have actually benefited and still want to benefit from uh, the interaction, the kind of service or consultation that they've received at the initial consultation. So after the initial consultation, so if you are going to get the best fully, if you have a prescription, you must present it to the right place. If you have to take it somewhere, you must get to the right pharmacy, a good pharmacy, access to a good pharmacist. I was talking about how the language that your doctor writes the prescription is for most of the time is for the team, is for your pharmacist. Okay, but you have a right to also actually know what your doctor is prescribing. That's one of the things you need to know. Okay, so you don't go to another doctor and say, "Oh, sorry, I didn't know the medications that I was given." No, it shouldn't be. Your doctor, your next doctor wants you to know that your former doctor has prescribed some medications, and you need to know those medications, those kind of treatments. If you're on admission, the kind of treatment you received, what for. Sometimes we request for medical, what do you call it now? Referrals. We get referrals, medical summary, you know, treatment summary from other centers, referrals and all. Okay, but there may not be all some details in those documents, but you as an individual can say, oh, this is what they did for me. They gave me an injection into my gluteus, they gave it into my vein. You describe it, and your doctor begins to have a picture of what you actually went through. So people don't see this as important. It is very important that you are able to describe, even if not in details. There are some patients that I have come across that they actually, they're able to say in specific terms what medications they were given and how they were asked to use it, how they used it, whether they used it as prescribed or they didn't use it. I mean, I enjoy interacting with such patients. That helps to also take decisions further to help them. Okay. So that language, if you go to a place, first of all, your doctor should be able to explain to you that these are the medications I'm giving to you. These medications are for these particular symptoms or to prevent this. But the details of how many days, how many times in a day, how many days, how to use it, your pharmacist should do that normally. Okay, some people still have to bring medications to the doctor to confirm, which is fine. There's no problem about that. Okay, so your doctor wants you to know that the way you use your medications is very important. The way you use your medications is very important. You should use. I was giving an example of anti-malaria the other time. So after the 8 hours, second dose, following the initial dose, subsequent doses, morning, night, or night, morning, depending on the timing. Okay. So if we don't follow this, for example, antibiotics also, if you don't follow the dosing in terms of the dosage, the timing, the frequency, and the number of days. Some people use antibiotics, oral medications for 1 day, 2 days. There are occasions that it depends on what your doctor is actually seeing and treating or what the history has been like. Okay, but if you are being commenced on antibiotics, for example, there are certain antibiotics for certain number of days, for a number of days, some 3 days, some 5 days, some 7 days, some can go as far as 14 days. Okay, some can go as far as 21 days, depending on the condition that is being managed. Okay, so you should know that this can affect how well you recover or how fast you recover. If you're able to get that very well. Okay, so some people have had this challenge of still having recurring symptoms because they fail to use medications as prescribed. But you can't get the medications as prescribed if you don't communicate with your pharmacist, if you don't ask clearly, if you don't say, ask specifically, how do I use this? Don't say, ah, they just gave it to me. I don't know how they said I should use it. No, no, no. That is where communication comes in. We're still referring to communication. There must not be any gap. But once there's a gap, it can actually give a gap to your health. And we don't want that to happen. All right. So thank you for engaging. Thank you for watching. Thank you for tuning in. Didi says, absolutely, sir. Absolutely. Yes, absolutely. Absolutely. Thank you. I'm going to pin. Okay, so I'm going to pin your comment so people can also check out your channel, Didi. All right. So I think if you have any question, please be free to ask. Okay, but we will move to the aspect of let me talk about uh, investigations. You know, talking about medications, some people come back and say, "Oh, they don't feel better." But the question is, have you used the medications as prescribed? That's the first question. Have you done the other things as planned? Okay, so before we talk about, oh, the drug not working, no response to treatment and all. So let's talk about investigations and we will probably wrap it up there. Now, do you know that your doctor is not just interested in having you pricked with needle, not just because your doctor wants you to go through a machine, but the fact is that if you need certain uh, tests or investigations to be done. So if you also think that there are some tests that you may benefit from that your doctor may be missing out, you can mention it. It still boils down to being free and then being confident to communicate with your doctor. So your doctor wants you to know that that is important. You know, there are some things that your doctor, even after all the communication, towards the end, you know, maybe you already talked about doing an ultrasound scan of the abdomen, for example, and by the time you are moving, your doctor has written the medications, reading some other tests, but has not filled the form for that ultrasound scan. You know, because you are also attentive, because there has been an initial communication on it, you will be able to remind your doctor of the ultrasound scan. Say, oh, so we need to add that. So that's the way it works. You need to understand that those tests need to be done. I know the challenge on this side, talking about the economic situation in certain areas, different parts of the world, you know, some people pay out of pocket and some people are not really able to afford these health services. So some people are not able to really go ahead to do some of these tests, but that doesn't mean that they are not important. But as a family physician, for example, I look at these sites, okay, the benefit of doing this thing, will it outweigh the cost in terms of, okay, if we don't do it, will it make any difference? Wouldn't it make a difference? Okay, so that makes it like, let's look at priority. What is needed for this patient? What will benefit this patient? Some patients may need empirical treatment, for example, first of all. That means treatment can be given while we are waiting results of investigations, or we are not choosing to do any test at this time. let's treat. And if symptoms persist or reoccurs, then we can take the step further. So there are provisions like that. There are opportunities like that. It's flexible. It's not rigid. So your doctor considers all these aspects, depending on your region. Some people are in places where the government, the healthcare system, the insurance coverage is very fantastic. So they may not have challenges with this. Okay, but some other places there has to be some consideration on this aspect. So you don't need to keep it to yourself. For people that may have that challenge, I'm not sure anyone on this platform has that challenge. That's okay. Maybe there are some basic tests that your doctor is requesting, and you feel that you don't want to or you cannot do at this time. You should be free to communicate, and then the doctor can take appropriate next step. All right. And finally, I would say that your doctor wants you to know that you should keep to your appointments. One bad thing about not keeping to appointment is that some people's condition gets worse, and then some people may even end up being brought in into the emergency. Some people may even be brought in already crossed to the other side. Okay, so but if you go beyond just um, the initial interaction to following the plan fully, the doctor will appreciate that. The doctor wants you to know that it goes a long way to helping in your management, in your health management. So you need to keep to your appointment, whether it's a physical appointment or a virtual appointment, you know, not just limited to appointments with your physician. We have other healthcare workers, other professionals that you may need to engage with, dietitian, physiotherapist, your behavioral therapist, different uh, categories of people that you may need to interact with. And I'm sure that when you consider these things, for those that are just joining in, you can watch the replay by the time the video is available on the channel. I'm sure you find very useful information from this live. So thank you once again for tuning in. We had we've had DMT. I call her DMT now. Diabetes Mindful Thoughts. I mean, she's been here. She did more than just showing up to letting us feel our present, giving a super chat. Thank you so much. Diabetes Mindful Talks. She's a nurse and she's based in Belgium and doing a lot, passionate about care for people living with diabetes. Okay. And she's so passionate about the plan, the way that many can actually get a reversal of that condition. Okay. With proper management, not leaving out their doctor. Okay. I want to say thank you once again, Chimeze Jennifer. Thank you for tuning in. Thank you for joining the live. And we have Didi and everyone that joined in, that probably was not able to drop a comment, but was watching. I really appreciate your presence. Uh, Let me know what you think. Tomorrow may that's a Sunday now, maybe evening or night like this, will just be dedicated to having a question and answer session. And it promises to be very interesting and informative. So get ready. We're going to be live together once again so that we can. Okay, tomorrow is a Saturday. Okay, we'll see whether it's Saturday or Sunday, and then we move from there. I put up a poll last time that which day would you prefer that we should set aside? We may have more than one day in a week, though, but we can start with one or two for a focus on common questions, question and answer. Maybe your own personal question. It may be question based on what you've heard, something you saw somewhere relating to health, wellness, and lifestyle. I'm sure with that, we'll be moving stronger in the community. And I celebrate all the creators in the house, all the YouTubers. I celebrate you all. Thank you for your support and your encouragement. I really appreciate. Thank you. So it's going to be a very pleasant evening from this side. I'll say good night, and wherever you are, please enjoy the rest of the day or night or afternoon, as the case may be. All right. Thank you, Didi. Bye for now.